Hello, I'm Suneet Mittal for Heart Rhythm TV with a segment of Advocacy in Action. Tonight, I'm joined by Dr. Ken Ellenbogen, Dr. Sana Al-Khatib, Dr. Mina Chung, Dr. DJ Lakkireddy, and Sarah Albright Alfano from the Heart Rhythm Society. Welcome, everyone. Tonight, we're here to talk about the Cardiomyopathy, Heart Education, Awareness, Research, and Training in the Schools Act, or the HEARTS Act. This was a recent piece of legislation that has passed both houses of Congress. It's an act that's very important and one that our society has worked very eagerly on and with a lot of effort. And I thought I'd start with you, Ken, by just highlighting the importance of this piece of legislation and the role HRS has had in making this come to light.
Thanks, Suneet. That's a great segue. Many of our members may not realize how involved we are in programs like this. Some as partners to other cardiovascular organizations, but some primarily leading on our own. We feel, and our members certainly support, that it is key to treating and raising awareness about sudden cardiac death and the cardiac arrhythmias that cause sudden cardiac death. And this bill will really highlight it in many ways. In addition to our members supporting our efforts to highlight these issues, we have HRS staff serving on key committees. For example, as part of the Smart Heart Sports Coalition, which you'll hear about from Sarah Alfano on this program. We also want to keep the public informed about our efforts in this area through our great website, upbeat.org. Additionally, we've held AED and CPR training every year at our annual meeting. This legislation, by the way, was the first campaign we used our new automated grassroots letter writing aid. So we enabled our community of physicians and scientists and nurses and nurse practitioners and PAs to write letters to our legislators to support our efforts into getting this act passed. I think it's really important that this is the beginning of us becoming more involved and more actively involved in fighting for advocacy for our profession.
Ken, thanks very much. And you mentioned the Smart Heart Sports Coalition, and I think it's pretty important. On this forum, we discussed the Damar Hamlin, what was initially a tragedy, but then became an incredible success story in light of the CPR and defibrillation efforts that took place. And I know the NFL was then very instrumental in working with other sport leagues to start this coalition. Sarah, I know you've been very involved with this coalition, representing us from the Heart Rhythm Society perspective. Can you tell our audience a little bit more about the coalition and the work that was done and how you think that really contributed to the ultimate passage of this bill?
Sure. Thank you for having me here. HRS joined the Smart Heart Sports Coalition pretty soon after it was formed in March of 2023, after Damar Hamlin's cardiac arrest, as you mentioned. And, the coalition really works to improve access to AEDs and CPR training in schools and youth sport organizations. So HRS joined the coalition, and we have staff members that are on both the programming committee and the legislative committee within the coalition. I myself work on the programming committee, which has worked to develop the AEDs for Youth program. That was an effort to get access for schools and sports organizations to the AEDs at a much reduced cost. So 20 to 60% off the rates that you can find anywhere else. And this is kind of the effort from the Smart Heart Sports Coalition to allow greater access to the AEDs for areas where budgets may be an issue. My colleague Lisa Miller works on the legislative committee of the Smart Heart Sports Coalition, and that is the one that is obviously very active in getting the legislation passed. We've been really successful since the coalition was formed, just a little over a year ago, in getting laws passed in Ohio, West Virginia, Michigan, Tennessee, Florida, all that are making an impact on AED availability and CPR training in schools and sports organizations.
Yeah, Sarah, thanks for that. And Sana, I'll turn it over to you. I know you've spent almost your entire career thinking about sudden death prevention and how to really improve efforts in this area. In your mind, what will legislation like this mean for our patients as well as our members?
Yeah, no, absolutely. Suneet, thank you for having me. And I absolutely was delighted to see the unanimous support that this act received by the US Senate. And I do want to acknowledge all the efforts of HRS staff and everyone involved, volunteers, what have you, to bring this to fruition. As you all know, this act will enable schools to have the needed resources to take care of victims of cardiac arrest by having access to high quality training and education related to CPR and early use of AEDs, purchasing AEDs, doing all the training that's required to optimize the outcomes of cardiac arrest in schools. And the schools will be better prepared with emergency response plans for when these cardiac arrests occur. And so how this would impact our patients and members is that this will eventually lead to improved outcomes for cardiac arrest, because as we all know, every 1 minute delay in starting CPR for cardiac arrest results in a 10% decline in the survival rate. So really, time is of the essence here, making sure that people recognize sudden cardiac arrest promptly and act promptly by starting CPR, using the AED as early as possible, will translate into improved outcomes.
Yeah, thank you, Sana. And I think the bill is also a beautiful reminder of the importance of advocacy. This started as a campaign that really grew, and ultimately advocacy was very important to make this what's going to ultimately be legislation. And DJ, you have been, a very strong proponent of the importance of advocacy. And this is just, I think, one concrete example. You've recently spearheaded an incredible initiative called Heart Rhythm Advocacy that you're co-chairing, a brand new initiative by the Heart Rhythm Society to really use advocacy to improve, efforts in a number of different directions. How do you think that HRA will further contribute to efforts like this? And can you talk a little bit more about, what is planned for HRA in 2025?
So, Sunita, thank you. But before we really get to the HRA advocacy, I just wanted to preface this with one of the papers that Heart Rhythm recently published called the High School CPR Study, which highlights the deficiencies and the hurdles of executing the high school CPR education program across the country, right? I mean, if you remember this back from the late 1980s, early 1990s, several states started passing legislations about mandating high school CPR education for high school kids. But unfortunately, like everything else in life, these legislations did not have enough teeth or appropriate amounts of support to the school districts for this to really be effective. And so as a result of which, you had an eyewash program that simply remained in existence, but it never really had the teeth, right? This is exactly what it exposed. And it is wonderful to see that this concept has come back and the HEARTS Act potentially adds some more teeth to it, adds more resources to it. So what does HRS want to do here? HRS wants to stand along with all of our partners in the space and really push for improving the overall campaign, the effective learning process for high school students, right? We have created a task force that specifically addresses CPR education and access to AED for high school, middle school students, as well as even college students for that matter, right? If you really think about it, this is the most important demographic that constitutes the most vital part of our society. And if we can educate this particular demographic and continue to reinforce that knowledge on a yearly basis over a period of time, you create an amazing, I would say, CPR angel force that can actually provide access to CPR and also improving access to AEDs. So this particular task force is going to come up with specific guidelines, teaching tools, toolkits for high school, school districts, colleges, and other places, and really teach them how to really go about it, right? It's one thing you sort of lay out broad strokes, but it's another thing to really implement a program. So HRS is going to come up with a specific program that is tailored to high schools and colleges. That way it can be a good resource. We also want our electrophysiologists that are spread all across the world, right, to be the champions of this cause, because this is something, as you pointed out, we live and breathe every day. And there is really no reason why the electrophysiologists in a given community shouldn't be working closely with other physicians in the community to really make this into a global campaign, right? And that's something Heart Rhythm Advocates is very seriously going to be involved in, and this task force is going to do the exactly same.
DJ, thanks very much. And, I guess that does bring the issue, I think, Mina, that DJ talks about teeth. And, one of the important teeth is, of course, funding. You need lots of funding, to have these initiatives go through. And some of it, probably does rely on federal funding, but that's often not enough. What are your thoughts as you've thought about this area, about what other steps will need to be done to ensure that we're able to ultimately accomplish what the bill intends to do?
Thank you, Suneet, and thanks for inviting me and all of us to talk about this. HRS and HRA are obviously supporting this, but we need the support of our members and our patients. But all this goes along with the big initiatives that HRS has been planning to tackle the sudden cardiac arrest challenge. We've been working on this and have worked on it with HRX and various programs at HRS. There are over 356,000 sudden cardiac arrests in the US per year. That's 1,000 a day. And the AEDs and CPR makes a difference in our outcomes. We're planning a lot of regional programs that DJ mentioned as well, including building toolkits for our members to help our communities. And we're working on promoting technology to detect the acute event of sudden cardiac arrest and to deploy our CPR providers, AED locators. So there's a lot of enthusiasm over this bill, but the implementation will be challenging. And we EPs really need to get much more involved. And we need to hopefully not only get involved by donations, which we would appreciate. So please donate to HRS and to HRA to help fund these efforts, but also get very involved personally. You can have a big impact on motivating students and moving the needle on sudden cardiac arrest.
Yep, and I must say that even in my house, in my own household tonight at the dinner table, both my girls said in discussing this, hey, a great reminder to get refresher training on CPR and AED training. So I think if we can continue to spur those types of efforts, across the board, then a lot of good will come out of acts like this. So Ken, some closing comments. This, I think, has been a great discussion. Anything else you'd like to leave our members with this today with respect to this discussion?
Yes, that you as an EP physician or healthcare provider can make a difference by learning CPR and teaching CPR. You can make a big difference. Support HRS and HRA in our efforts. We need your help.
Well, thank you everyone for joining and having such a nice discussion about a really important topic. It's really great to see this come to fruition, and we look forward to continuing to report the progress of this legislation on this forum and at meetings across 2025.